Well, hello, good morning, good afternoon, good evening. Welcome everyone to our webinar today. I'm Laura Messineo. I'm the Chief Nursing Officer for Worldwide Health Staff Solutions. And today we're excited to talk about understanding clinical expectations in a step-down unit. I'd also like to introduce Tracy. Tracy, I'll let you share.
Hello. Hi, everyone. Thank you, Laura. My name is Tracy Toothaker, and I'm the Director of Recruiting here at Worldwide Health Staff. And Laura will be leading the charge, and I'm going to be here to answer any questions that come up along the way. So feel free to ask away in our chat.
Thank you, Tracy. So I've been at Worldwide Health Staff for about 1.5 years, but I have been a registered nurse for over 33 years. My career was specifically focused on critical care areas, anything from ICU to cath lab, and then I evolved into leadership positions at health systems, and I managed a lot of virtual health operations, and I'm thrilled to be here today to talk to you about step-down units in US-based hospitals. Next slide. So what really is a step-down unit? It's also known as a progressive care unit, which many of you may recognize, but it's a specialized area that is designed to care for patients who are stable but do not require close monitoring and supervision like you would see in an intensive care unit. It's basically like a bridge step from the intensive care to a medical surgical unit. And so let's just talk a little bit about the differences between units. So typically, a medical surgical unit is a unit where there are very stable patients. It allows a nurse to round on those patients. They typically have 5 or 6 patients in a med-surg unit. They also have a patient care tech that helps to support them in that clinical unit, but they're usually very stable patients that we're planning on discharging from the hospital. A progressive care unit, similar to the step-down unit, is really used to provide intermediate monitoring and care. So in this scenario, it's very similar to a step-down unit that you perhaps still have telemetry or watching the EKG monitors on these patients. They could have some drips that they're needing to monitor, and the nurse-to-patient ratio is smaller. The intensive care unit is obviously the highest level of care in a hospital. It is the highest acuity of patients. There are very sick patients, and you typically have a 1-to-1 or 1-to-2 model of a nurse caring for those patients. These patients require constant and immediate interventions. There's active things changing with these patients. You're managing multiple different drips. You could have patients on ventilators. And then a high dependency unit is similar to the same day or the step-down unit or the progressive care unit. It, again, is patients that require close monitoring, different than the med-surg unit. They need just a little bit more hands-on care, and your nurse-to-patient ratios are smaller. So next slide. So the patient population really is consistent of postoperative patients, such as cardiac patients, bariatric patients, or transplant patients. These are patients after they're off many of their medications that are given via IV. They're patients that have been extubated. If they were ventilated in the ICU, they might be on some oxygen. It's also patients recovering from acute medical events like heart attacks and strokes and respiratory failure, and also patients with complex conditions such as septic shock patients that are still being stabilized, that are more in a severe sepsis state. In this patient population, it is also these individuals that are in there are requiring frequent nursing interventions. As an example, these nurses that are caring for these patients perhaps might be titrating insulin drips. They might be doing wound care on these patients. Sometimes these patients may have a tracheostomy, and they'll need to clean that site. They'll need to make sure that the patient's being oxygenated appropriately. But that's a high level overview of the patient population that would be seen in a hospital step-down unit. Next slide, please. So the staffing and equipment, the nurse to patient ratio is typically higher than in a general ward or a med surge unit. So you're typically seeing like a 1-to-3 or a 1-to-4 ratio in the actual step down unit, which is lower than the ICU, which is like the ICUs. However, you're taking care of more patients in the actual step down unit rather than in an ICU. An ICU is 1-to-1 or 1-to-2. There's a lot of different medical technology that's utilized in one of these units. Great example of that is cardiac monitors. In these units, we're still looking at patients' heart rhythms. We're looking at their blood pressure. We're looking at their O2 sats. We're also using oxygen delivery systems. We could be using anything from face masks to BiPAP to ventilators in some scenarios, especially in the patients that have a tracheostomy. And then also devices for managing drains, catheters, and tracheostomies. Next slide, please. So education and certification, that's always something that comes up within any sort of clinical area within a hospital. And it's always good to look at what opportunities are out there for your education and certification. So RN licensure obviously is one of the things that is required. And that's really for any role within the hospital setting if you're practicing as a registered nurse. Your credentials are granted by the regulatory board of the state that you're actually practicing in. And as a registered nurse in the United States, it requires you to pass the NCLEX exam. It also requires you to have proof of education of where you went to school. And in addition to that, it also requires you to maintain your competencies, such as continuing education hours. Another thing that's extremely important in this clinical unit is basic life support. That is something that you need to renew each year, and that it validates your ability to perform CPR and also to use an automatic external defibrillator. It allows you to quickly be able to use critical thinking skills in order to provide basic emergency care. And we renew this every 2 years. Next slide, please. So what really are the benefits? A couple of the benefits of this clinical unit is really to improve patient outcomes. We know that they need a bridge from the ICU in order to become stronger and healthier in order to ultimately be transferred to a medical surgical unit and ultimately home. This area really focuses on rehabilitation and also weaning the patient off of drips that they're on. This area also reduces our healthcare costs. And why we say that is because if patients were to stay in the ICU, the cost of care would significantly be higher. We utilize this clinical area for patients that are transitioning out of ICU. It gives them a nice bridge area to be able to recover before they eventually get to the med-surg unit. It also enhances patient flow. We typically say this is improving throughput through the health system from different levels of care. Specifically, we know the intensive care units are very, very busy. And as higher acuity patients come into the emergency room, or we have increased number of OR cases, it requires us to have room in the ICU for those patients. So the step-down unit really is a key area in order to bridge that gap and transition patients out as their condition is improving. Next slide, please. So let's talk a little bit about what a workflow would look like when you're actually on a step-down unit. The first thing it starts off with is the actual admission. In the admission, you're going to learn, what's the patient's history, what are the current medications they're on, any devices that they're connected to, any sort of specific monitoring you need to do, if there's wound care assessment that needs to be done. It also allows you the opportunity to ask questions of the actual nurse that had been taking care of that patient before the patient was in this unit. Another big part of the initial admission is that you're going to be able to identify if there's any gaps in the care delivery process, and you can ask those questions then to that nurse. The next step is the initial assessment of actually assessing your patient and performing care planning. So what is consistent of nursing assessment? So one example is that an NIH stroke scale is going to be performed on the patient. If the patient is a stroke patient, that is something that you're going to do on this patient to ensure that there's no changes to their score. You're also going to be doing dysrhythmia monitoring. So you're going to be looking at the EKGs on the cardiac monitor, looking to see if there's any changes in the EKG. And then in addition to that, there are going to be labs that are drawn, and blood gases are going to be drawn on patients, and you're going to need to be able to interpret those. In this, you're also going to see a multidisciplinary team involvement. So what we mean by multidisciplinary team is that you're going to have physicians, you're going to have physical therapists, you're going to have dietitians, respiratory therapists, case managers, and you as a nurse all collaborating on that patient, reviewing the current treatments and protocols that the patient's on, any improvement or any challenges in the patient's care or changes in the patient's care will all be discussed through that multidisciplinary team. You should feel as though you have a voice at the table. You are the voice of the patient when you're in a multidisciplinary team. And that patient really wants you to be the individual that can share the concerns they're having or concerns the family has, but then also using your critical thinking skills in order to share any observations that you've had in the assessment of your patient. In the care planning portion of this, that's going to include frequent monitoring and documentation, medication management, and actually establishing some discharge goals, identifying what key aspects that the patient has to improve upon in order for them to get to the next phase in their healthcare healing process. And that's critical to the patient's health status. Then the next step in the step-down unit workflow is really your daily workflow. So in the morning, that is a key time for you to do shift handoff with the oncoming shift. Sometimes it's also referred to as a safety huddle, where you actually have a couple of team members that are in a huddle and giving information on each patient. During that morning handoff, you're going to talk about their vital signs, any labs that have been drawn or any that are pending. You're also going to do a medication reconciliation during that time. You're also going to see physicians rounding during that time. So it's a very busy time in the morning where physicians may be asking questions as they're rounding on the patients. And then you're also updating the care plan. Then as you move on during your day, during the midday, you're going to have diagnostic tests that are being scheduled for your patients, such as a CAT scan or an MRI or an echocardiogram. All of those tests would be scheduled, and you would be anticipating when the patient had to either leave the unit or if different teams are coming into the unit in order to perform that test at the patient's bedside. Also, during this time, you may see bedside procedures that are taking place, like a chest tube being inserted. Another key aspect of this is that this is a time where you're providing updates to the family and you're also educating the family on the status of their loved one. You're also educating the patient and answering any questions that the patient or family may have regarding their care. Then in the afternoon, that's a key time where we're actually looking at, is this patient appropriate for discharge? We do some discharge planning during this time. If the patient is ready for a discharge, then we'd be coordinating transfer to another clinical unit, waiting to see if there is an open bed on a general med surg unit. And then at that point in time, you would be giving a handoff to the nurse on that unit. In addition to that, in the afternoon, we really look at if patients need to remain in this unit, that we would be working on the patient's mobility in any sort of therapy session. So you may see physical therapy coming in and getting your patients up. You might be seeing occupational therapy, working on activities of daily living with your patients, or speech therapists working on patients that have had strokes and their speech. And then most of all, you're also doing a lot of documentation of all of these activities and reviewing your care plans to make sure they're up to date. And then from a quality and safety perspective, we know that these patients make huge strides in order to improve their lifespan, recover from a condition. And some of the things we focus on is falls. We talk about infection rates. Those are all things that in a step down unit, there's strict protocols so that we improve the quality and safety of those patients. Next slide, please. Oh. So now it's time for our questions and answers. What sort of questions do you have as a group about working in one of these units?
Thanks, Laura. And also, I know we put this in the chat, but we would love to hear where you're joining us from. So if you haven't done so already, add in where you're joining. And yes, would love to hear your questions. I know we had a couple that we've addressed in the chat so far, but happy to answer any others. And it looks like, oh, absolutely. Good afternoon from Nigeria. Thank you for joining. And we'll see what kind of questions we have trickle in. But that was all great information, Laura. Thank you so much for sharing that. I know I learned a lot.
Well, and I think, every clinical area has different nuances to it. I'll also share with you just, a couple of other little nuggets about working in this unit. Oftentimes, ICU nurses come through those units, especially if there's a low census in the ICU. So even if you're not working in a progressive care unit, if you were an ICU nurse in the United States, you could anticipate that at some point in time, you might be rotated through that unit. Most nurses that are ICU nurses that are brought to that unit almost feel like it's a breath of fresh air because the patients are not as high acuity, and your nurse to patient ratio is a little bit more, and you have a little more flexibility with caring for those patients. I think the other thing is that this clinical unit allows for a very flexible staffing model based on the acuity of the patients. You're actively removing different therapies and treatments from these patients because each day or each hour they're getting stronger and healthier. So that's just a couple other facts.
That's great. Thank you for sharing. Okay, it looks like we've got a couple more trickling in. So some folks joining from Saudi Arabia, Qatar, South Africa, Ghana, UK, another Qatar participant. So welcome. Amazing. We've got folks representing all over. We love to see that. and let us know if you have any specific questions. Obviously, Laura is happy to answer about any of the content she just covered and shared. I'm happy to answer any questions that might be specific to opportunities as a whole. So feel free to let us know. Welcome from Jamaica. Happy to have you. This is great. KSA. Amazing. Thanks, everyone. Okay. Well, it looks like just a couple questions we had, we addressed. And Laura, I think what you shared was just so informative. There were no questions.
Well, thank you everyone for joining.
Yes, thank you. And for those of you that have tuned in, please be sure to connect with us. We would love for you to subscribe to our YouTube channel where we have other great webinars posted along with additional other content. Like us on Facebook, follow us on Instagram. And then, of course, if you're interested in learning more about other opportunities, please feel free to apply directly to our website at healthstaff.org. We'll drop that link in the chat too for you to apply directly. We do have another question, it looks like, from Kyle, who's working in long-term care, but curious if they have a chance to work in a telemetry area or unit.
So typically, if you're working in a long-term care area, it depends on if you already have that experience, or in the long-term care, if you're utilizing cardiac monitors. If you're not using cardiac monitors in your long-term care area, what I would encourage you to do is take an EKG course. In an EKG course, you would learn the different heart rhythms that would enable you to work in a telemetry area.
That's great advice. Thanks, Laura. Okay. One other thing to mention, if you are already engaged in working with us and have a friend that you're interested in working with for your journey to the United States, we would love the opportunity to reach out if you want to refer a nurse. So we'll provide that link in the chat as well. And the great part about our referral program is that you can earn up to $250. So please feel free to refer that way or apply directly through our website. So thank you, everyone.
Thank you.
And it looks like, okay, we'll hang tight for one more second. Looks like we might have a question coming. And we did have someone join from Singapore. That's great. Welcome.
We love to have students join.
Yes. It looks like Nana had a question, might be typing perhaps. So we'll give this one more minute and see. Okay. Don't see it coming through quite yet. But the good news is if anyone else has a question, please, again, feel free to reach out directly. We're happy to answer anything outside of this exact venue. Let's see. Oh, next steps about paying a fee bill if you've submitted your civil documents. Yeah, good question. And then we can absolutely help you. There's some other steps involved beyond those steps and processes. So happy to answer that question directly if you want to reach out to me, and I can connect with you about your particular case and what follows after those steps. So I think if you want to reach out here, I can even reach out directly to you. I think I've got your details here. So happy to help. I'll connect with you individually. Okay.
I think there's one more question.
Oh, yes, there is. Okay. Is there any job that I can apply to for a CNA? Probably by next year. So thank you, Mariquette, for your question. The majority of the opportunities that we have are for RNs and on an EB3 visa. So we don't currently have any opportunities in a CNA capacity. However, we do encourage you to still apply and reach out, and we can discuss that path with you and help you determine what steps need to be taken to come to the United States in an RN capacity. Okay. All right. Thank you again to Laura. Thank you everyone for tuning in, and we appreciate it. Until next time.
Thank you.